Hello, and welcome to Brainetainment, where we make learning fun and engaging. We're your go-to hub for all things informative, with a dash of entertainment thrown in for good measure. Our mission? To transform the way you perceive learning, one video at a time. From the mysteries of the universe to the intricacies of the human body, no topic is off limits. Today we're delving into the world of cosmetic surgery. You've heard the term liposuction, but do you really know what it entails? Well, strap in, because we're about to take you on a step-by-step journey through the entire process. We'll demystify the consultations, the preparations, the procedure itself, and even the recovery stage. So, whether you're just curious, considering the procedure, or simply want to broaden your knowledge, we've got you covered. Stay tuned to find out how liposuction works right here on Brainetainment. Before we delve into the process of liposuction, it's important to understand what it actually is. Liposuction, also known as lipoplasty or body contouring, is a type of cosmetic surgery that breaks up and sucks fat from the body. It's typically used on parts of the body where fat is hard to get rid of, like the abdomen, thighs, buttocks, neck, and backs of the arms. The primary purpose of liposuction is not to reduce body weight or treat obesity, but to reshape certain areas of the body, particularly when diet and exercise have not been effective. It's important to note that liposuction is not a treatment for obesity or a substitute for proper diet and exercise. The procedure is usually carried out under general anesthesia and is best suited for individuals with a stable body weight who have areas of excess fat resistant to exercise or dieting. Now that we have a basic understanding of liposuction, it's time to dive into the actual process. The first step in the liposuction process is the consultation stage. It's not just a casual chat, but a crucial part of the journey. It's an opportunity for the doctor and patient to establish a rapport, understand the patient's desires and concerns, and make sure that liposuction is the right choice for them. The consultation begins with a discussion about the patient's medical history. It's essential to be open and honest during this conversation. Remember, the doctor isn't looking for reasons to judge, but to ensure your safety. They'll ask about any existing medical conditions, previous surgeries, allergies, and current medications. This information helps the doctor assess the patient's overall health and determine if they're fit for the procedure. Next comes the physical examination. This isn't your usual checkup. The doctor will assess the areas of your body you're looking to improve. They'll look at the quality of your skin, the distribution of your fat, and your body shape. This examination provides a better understanding of what can be achieved through liposuction. Now we move on to arguably the most important part of the consultation, setting realistic expectations. Liposuction is a fantastic procedure, but it's not magic. It can significantly refine your body contours, but it can't eliminate cellulite or result in significant weight loss. The doctor will explain what liposuction can and cannot do, ensuring that your expectations align with what the procedure can realistically deliver. The consultation stage isn't just about the doctor assessing the patient. It's also an opportunity for the patient to ask questions, voice their concerns, and get a clear understanding of the procedure. The doctor should explain the risks and benefits, the type of anesthesia to be used, the cost, and the recovery process. It's a two-way street, this consultation business. It's about making informed decisions and ensuring the best possible outcome. Once a patient has been deemed a good candidate for liposuction, they can move on to the next stage. The second step in the liposuction process is the preparation stage. This is a crucial phase as it sets the groundwork for a successful procedure and recovery. It's not just about physical readiness, but also about mental and emotional preparedness. One of the first things that patients need to do is adjust their diets. Certain foods and drinks can interfere with the body's healing process or the effectiveness of anesthesia. So, patients are often advised to avoid things like alcohol, caffeine, and certain vitamins or supplements for at least a week before the surgery. A balanced diet rich in fruits, vegetables, and lean proteins is typically recommended to boost the body's natural healing abilities. Medication adjustments are another significant part of the preparation stage. Patients must discuss all the medicines they are currently taking with their surgeon. This includes over-the-counter drugs, prescriptions, and even herbal supplements. Some of these might increase bleeding or interfere with other medications used during the surgery. Therefore, the surgeon might advise the patient to stop taking certain medications temporarily. And let's not forget the importance of a support system. Liposuction is a surgical procedure and it requires downtime for recovery. It's essential for patients to arrange for someone to drive them home after the surgery and assist them in the first few days of recovery. This support system can help reduce stress, which in turn aids in a smoother recovery. Mental preparation is also crucial. It's normal to feel a mix of excitement and anxiety in the days leading up to the surgery. Patients are encouraged to discuss their fears and concerns with their surgeon or a mental health professional. Understanding the procedure, knowing what to expect, and having realistic expectations can help alleviate anxiety. Remember, preparation is the key to success in any endeavor, and liposuction is no exception. The more informed and prepared a patient is, the better the chances of a smooth procedure and recovery. After ample preparation, the patient is now ready for the actual procedure. The third step in the liposuction process is the actual procedure. Now, this is the part where the magic happens, where the transformation takes place. But before we dive into it, it's important to remember that liposuction is a surgical procedure and should be performed by a qualified professional in a sterile environment. The process begins with the administration of anesthesia. This could be local or general anesthesia, depending on the extent of the procedure and the preference of the patient and surgeon. The anesthesia ensures that the patient is comfortable and pain-free throughout the procedure. Once the anesthesia has taken effect, the surgeon makes a small incision in the skin. This incision is usually less than 1/4 of an inch. It's through this incision that the surgeon will insert a thin tube known as a cannula. The cannula is connected to a vacuum-like device. The surgeon moves the cannula back and forth to loosen the fat cells. The vacuum then sucks out these loosened fat cells, effectively removing them from the body. This process is repeated until the desired amount of fat has been removed. It's important to note that liposuction isn't a weight loss procedure. It's a body contouring procedure aimed at removing stubborn pockets of fat that don't respond to diet and exercise. After the fat has been removed, the surgeon closes the incision. This is usually done with dissolvable stitches, which disappear on their own over time, or with a stitch that will need to be removed later. Sometimes a small drain may be left in the incision site to remove any excess fluid. And that, in a nutshell, is the liposuction procedure. It may seem straightforward, but it requires a skilled hand, an artistic eye, and a deep understanding of the human anatomy to sculpt the body in a way that looks natural and balanced. Once the procedure is complete, the patient moves on to the final stage. The final step in the liposuction process is the recovery stage. This phase is just as crucial as the procedure itself, as it paves the way for your body to embrace the changes made. First, let's talk about the potential side effects. Some patients may experience swelling, bruising, or minor pain, but these are all part of the body's natural healing process. It's important to understand that every individual heals at their own pace, and the recovery timeline can vary. Typically, the initial recovery period lasts about 1 to 2 weeks, during which patients are advised to wear compression garments to help with the swelling. Regular light walks are also encouraged to promote blood circulation. Now, on to post-op care. It's essential to follow your surgeon's instructions diligently, from taking prescribed medications to keeping your follow-up appointments. Remember, your body has undergone a significant transformation and it needs time to adjust. With proper care and time, patients can fully recover and enjoy the results of their liposuction. Now that we've taken a detailed look at the liposuction process, let's summarize what we've learned. Liposuction, an increasingly popular cosmetic procedure, involves the removal of excess fat from specific areas of the body. It all begins with a consultation stage where the surgeon assesses your health and discusses your goals. Next, we move on to the preparation stage. Here, patients need to follow certain dietary restrictions, stop smoking, and avoid certain medications. Then comes the procedure itself, where the surgeon makes small incisions, inserts a cannula, and uses it to break up and suction out the fat. Finally, we touched on the recovery stage. This involves a period of rest, wearing compression garments, and taking prescribed medications. It's a journey, but one that can lead to increased confidence and satisfaction with one's physical appearance. And there you have it, a step-by-step look at the liposuction process. Don't forget to subscribe to Brainetainment for more informative and engaging content. Until next time, keep learning.